Hello everyone, my name is George Beaton. I'm a second year medical student at the Texas College of Osteopathic Medicine, and I'll be presenting a case study today on hollow-spinal epidural abscess. Hollow-spinal epidural abscesses are spinal epidural abscesses that run the entire length of the spine, from the cervical spine through the sacral spine. They represent about 1 in 1 million hospital admissions, making it an exceedingly rare condition. The etiology is not always clear, however it is postulated to be from hematogenous seeding or direct spread from local abscesses that invade the spinal epidural space, and then the infection is free to spread along the length of the spinal canal. Common symptoms include fever, leukocytosis, elevated C-reactive protein, back pain, sensory impairment, and extremity motor weakness. Diagnosis is made via MRI, and the scans generally reveal fluid in the epidural space and concomitant compression of the spinal cord. Broad-spectrum antibiotics are virtually always indicated upon diagnosis with any spinal epidural abscess. Furthermore, if fulminant neurological impairment is present, emergency decompression of the spine is indicated. Generally, patients presenting with neurological defects who are treated with early, aggressive medical care before severe compression can occur tend to achieve the greatest improvements in their symptoms. In our case, a 60-year-old male presented to the hospital with fever, neck pain, and altered mental status. His past medical history was significant for alcohol and IV drug abuse. While at the hospital, his mental status continued to decline and he became hypoxic, requiring intubation. Following intubation, an MRI of his cervical, thoracic, and lumbar spine revealed a hollow spinal epidural abscess as well as multiple paraspinal musculature abscesses and a retropharyngeal prevertebral abscess. A reliable motor and sensory neurological exam was limited due to the intubation and sedation. He initially had normal reflexes, negative Hoffman's sign, and 1 to 2 beats of clonus bilaterally. He was treated with empiric broad-spectrum IV antibiotics. The following morning, his infectious lab markers had worsened, and he now had 5 beats of clonus on exam. Without signs of improvement in his infectious lab reports or a reliable neurological exam to trend, the decision was made for urgent operative debridement of the hollow spinal epidural abscess. Using a standard midline approach, laminectomies were performed at the T4 and T10 level. The lamina and ligamentum flavum were excised and sent for pathologic analysis. Once the laminectomies were completed, a pediatric feeding tube connected to a 30 milliliter syringe was directed cranially in the epidural space through the T4 laminectomy site. This tube was used to gently aspirate purulent material in the cervical spine. This was repeated in a similar fashion at the T10 laminectomy site, with the tube being directed towards the sacrum. After using gentle aspiration to collect purulent fluid for culture, the 30 milliliter syringes were filled with debridement antibiotic solution, which was used to gently irrigate the spinal canal. In a similar fashion, alternating irrigation and aspiration were performed through the length of the spinal canal until no further purulent material was obtained. He was continued on vancomycin postoperatively for his blood cultures that had been positive for MRSA. His respiratory status improved following surgery, and he was extubated 2 days postoperatively. His mental status improved, and he was transferred out of the ICU 4 days postoperatively. Neurologic exam had returned to normal with 5 out of 5 strength in all extremities, and there was no clonus or hyperreflexia by postoperative day 4. He followed up in the orthopedic spine clinic for 3 months post-op and continued to have no neurological defects. He was ambulating without assistance, and his wounds had healed completely without signs of continued infection. Hollow spinal epidural abscess is a very rare condition but can have significant morbidity or mortality. In addition to broad-spectrum antibiotics, surgical intervention can be beneficial to decompress the infection and improve outcomes. This case provides evidence for the efficacy of selective skip laminectomies with irrigation of the spine and treatment of hollow spinal epidural abscesses. This technique allows for identification of the inciting organism, adequate reduction of the infectious burden, decompression of the neural elements, minimal surgical time and blood loss, and maintains stability of the spinal column without the use of instrumentation. Thank you.